After carrying a pregnancy to term, mothers usually expect to hear the musical sound of their baby's first cry. Unfortunately, sometimes they are met with a deafening silence.
I think ever since women have been having babies, there has always been the possibility of the pregnancy ending in a stillbirth. And by stillbirth we mean a baby that has developed to the point of being able to survive in the uterus, but unfortunately the baby has succumbed before being born.
These deaths are, however, hardly recorded, though noticeable stillbirths amount to an invisible public health problem.
We're often faced with a situation where a mother has lost a baby either during pregnancy or actually during the birth, and the baby has succumbed, and the mother, instead of going home with a live baby, the mother is left with this terrible loss.
So far, there are no reliable statistics on those deaths in Kenya. Not many other countries kept accurate records of stillbirths either, until recently when The Lancet, a leading international medical journal, conducted a study on it. The statistics indicated that 2.6 million babies are stillborn every year worldwide, which translates to 7,300 cases daily.
We do know quite a lot about statistics for mothers who die in pregnancy, and we know quite a lot about the statistics for babies who die after birth, children who die, but unfortunately we don't know very accurately the numbers for the babies that are lost before birth.
Even more depressing for the mother or couple that has lost a baby is the stigma associated with stillbirths.
Whereas when one of our relatives dies, often there's quite a big public show, and it's a funeral, and funerals are very big in this country, and it's almost it's a recognition and a marking of what's happened. But unfortunately, sometimes I think when a mother loses a baby, it is a silent grief that maybe other family members, maybe don't want to talk about it, or they think maybe she did something wrong.
The sound of a baby's heartbeat is a good sign, indicative of the fact that a baby is alive and well. But as this can only be determined in a clinic, a mother should be keen to note the frequency and pattern of the baby's movements in her tummy.
I think some traditional beliefs actually say, well, if your baby's playing too much, it's a bad sign, there's something wrong. And actually that's not the case. It's the other way around, that what we're worried about is when a baby is not playing. So a baby that is moving is a healthy baby.
Research has now established what is called the big 5 causes of stillbirths.
First of all, childbirth complications. So, for example, a baby that is basically healthy, but something goes wrong actually during the labour, and the baby succumbs during the labour. The second one is maternal infections, and probably in Kenya we would highlight particularly malaria is the most important one.
Maternal disorders, particularly a condition known as preeclampsia, where blood pressure goes up during pregnancy, is also another major cause of stillbirths.
Preeclampsia can happen to anybody. It's not something that is really predictable. It's perhaps more common in first pregnancies, but it can happen to anybody, even somebody who's had a previously normal pregnancy. And we just have to detect it by taking the blood pressure and testing urine for protein.
Doctors are concerned that there seems to be an emerging epidemic of diabetes, especially during pregnancy. Another cause of stillbirths is fetal growth restrictions and congenital abnormalities, a situation where a baby's organs fail to develop.
Probably the placenta is not working very well. It's not feeding the baby enough oxygen and enough nutrients.
Initially, doctors believed that they could pick up the problem by weighing the mother as the pregnancy progresses. But research now indicates that that is not a useful test, because some babies could be growing normally, but the mother's weight doesn't change much. Or similarly, they can have a baby that's not growing, even though their own weight is increasing.
So we're tending to rely more and more on measuring the mother's tummy with a tape measure to tell us, is the tummy getting big at the right rate?
Fortunately, a significant number of stillbirths are preventable.
Doctors are now recommending to all women who are thinking of becoming pregnant, or who might be pregnant in the next few weeks or next few months, which is to take a supplement of folic acid every day. And this is not a kind of drug treatment dose of folic acid, it's just a nutrition supplement dose. It's the kind of thing that one can find over the counter in the shops.
Other ways of preventing stillbirths include ensuring mothers make the 4 antenatal clinic visits without fail. They should also make use of mosquito nets to avoid malaria infection. Delivery should also be done in hospitals in the presence of skilled medical attendants to avoid death in the event of childbirth complications. Sylvia Chebet for Sunday Live.